this afternoon. The country's top medical experts are in the Ashanti region capital as they seek a solution to the fast rising COVID-19 cases. The country's active cases have increased substantially over the last few weeks. Our focus this afternoon is on the situation in the regions because the Ghana Medical Association is warning that intensive care units in across major hospitals are being overstretched as a result of the rising COVID-19 cases. We start by looking at the current case counts, and right there on your screens, you will see that the new cases are rising to 382. That's the new cases we have. Active cases now 2,858. Confirmed cases 98,817. Recoveries 95,147. Deaths have now risen to 812. Let's look at the regional breakdown, and in there you can see the red spots in that map over there for you. You have the highest cases coming from the Greater Accra region, which is 54,115. The Ashanti region has 16,889. Western region has 5,984. Eastern region 4,559. Central region 3,552. Volta region 2,664. In the northern region, you have 1,661. Bono region 1,494. Bono East 1,467. In the Upper East region 1,321. Western North region 935. Ahafo region 847. Upper West region 500, Oti region 467, Northeast region 231, and Savannah region 132. So it's clear that Greater Accra, followed by the Ashanti region, are leading with the highest cases. Now let's start with the compliance in Kumasi, and my colleague Oheme Nteria will be telling us more on that one. Oheme, good afternoon to you.
Good afternoon, Aisha.
Yes, and of course, I'll also be joined by other health experts in this conversation. But before we even have this conversation, let's listen to some people in Kumasi complaining about compliance.
There's nothing I'm doing about the safety protocols. Me, for instance, the way the media were preaching about this coronavirus pandemic, nowadays I've not been hearing it. So me, I think it is gone for good, and there's no way it will come back. I heard really the Ashanti region, we are leading. When you will see our attitude, the attitude of the people in the Ashanti region is very bad. Though it is not gone it is not gone. But the way, especially when you sit in the trotro and the taxi, people are not wearing their nose masks.
The Ashanti region, we are having a problem because of the political interference of the district. Because recently, when the St. John burial, and a lot of people are making a lot of comments that if the president will be making all the necessary about to wear the face mask and all this, and then they themselves during the funeral, there's a lot of things happen there, and then because of that, a lot of people, then you can't be communicate to some people who are not wearing it, because when you try to let them to use what you are doing, they are trying to refer you to the politician.
Coronavirus, I said, in said that you say coronavirus be a because here abrofun, I want coronavirus start free by you. The Euro see our mobile, when you pay good stadium, you did the ye. Now I ain't Ghana the coronavirus be concluded. I mean, they will say, and when you phone this kadi, oh, abrofun, because here. We are not adhering
to the protocols because we are tired of them. Every day there's new virus. Every day there's new virus. We don't know what to do again. We are tired of them. They should come and kill all of us. We are tired of them.
And joining me via Zoom for more on this conversation, Ohim Interior is already on. Also on this is Dr. Pakwesi Beidou, who is the Ashanti Regional Chair for the Ghana Medical Association. Plus on Zoom this afternoon, Dr. Samuel Kojo Amwakohene, who is an anesthesiologist, a COVID-19 ICU team leader at the ACHN Health Network Connecticut, and co-founder and president of the Global Partnerships Haloden LLC. Thanks so much, gentlemen, for your time. All right, let me start with you, Hemming. Why has it been difficult for people in the region to adhere to the protocol?
Aisha, a lot goes into why people are not adhering to the COVID-19 protocols. There's a lot of belief surrounding the COVID-19 in the region. Remember when the Ashanti region recorded the first cases in Obuasi, and later the disease spread to other parts of the region. Some municipal and district assemblies recorded some of these cases. People believe that COVID-19 is not even real. So even when there are people who thought that it is the figment of imagination of the politicians who have couched this whole idea to make money out of it. And that even when a hospital, is said to have reported COVID-19 case, there was this belief that the hospital or the facility will cash in, get a lot of funding from elsewhere. And then this will go a long way to also, help the managers of these facilities. And so, yes, people have their own beliefs and idiosyncrasies as far as COVID-19 is concerned. Then, fast forward, the issue of John's funeral also came in to play a very big role. People thought that, yes, if you synchronize this, big funeral where a lot of people should be buried, not any other person than top government officials, the president, his vice, the chief justice, a lot of government, officials also came in and participated in this funeral to the point that other people were seen not in their face mask whilst in this community. And so this has, made things difficult for people to adhere to the COVID-19 protocol. I must say the whole of yesterday, I was at the Kumasi Central Market area and then to the KGTR market and the Juso market, especially on a Sunday like this. It's a market day in Ejuso. And if you saw the number of people who were have gathered at the market and to see few people in their face mask, then it tells you that, yes, even those who were shouting and calling for people to attract the attention, people to their wares, none of them were in their nose mask. Just that a few of them, patients who had come from outside the community to patronize the market, a few of them were seen in their face mask. And so, yes, people have their own beliefs, thinking that after all, even if we die, then all die be die. As it has already been said somewhere, that yes, if the president and some top government officials come to the funeral, participate, even when we had a ban on funeral gathering and all that, and then they think that they have their liberty, they have the freedom to do whatever they want.
Okay, I think we're losing on him interior there. We'll try and get him back, but he makes the point clear that people are just unwilling to put on their face mask, and some of them are now expressing fatigue. And that is why we're lucky to have Dr. Pakwesi Beidou, and who is the Ashanti Regional Chair for the Ghana Medical Association. Doc, I'm grateful for your time. Thanks for all the good work you've been doing. We've been to the streets to look at the compliance level. there appear to be fatigue on the part of residents, and exactly what my colleague has been saying. What can we do differently?
Yeah, thank you for having us once again on your program. And yeah, though the population is fatigued, I don't think those of us with the Ghana Medical Association, we are as fatigued as them. And we'll continue to talk about COVID-19. And the reason being that when the cases goes up, it's the health workers who invariably will bear the consequences, because, the patients are brought to us and you cannot run away from them. Yes, I think the sentiment has been summarized by Ohimin Tewia, our good friend. And from the interview you granted, even if you go to most of these state or private entities, I mean the banks, shops, and everything, as Ohime said, you can count on your fingertips the number of people who are complying with the COVID-19 protocols. The only places where people are made to adhere probably are the hospitals. And when you there raise the issue, they tell you, oh, have you finished advising the politicians to come and advise us? And it's been the situation. As once again has been stated, funerals are going on as if nothing is happening. The last time, if my memory serves me right, and I stand to be corrected, I think there has been a ban on funerals, and I don't remember the president lifting the ban on funerals. But come to, on Saturdays, in fact, Thursdays, Fridays, Saturdays, Sundays, come to Ashanti region. Things are going on as usual, and it's led by the politicians. We all know what has been going on. So to your question, what should be done differently? I think we should go back to where we were with insistence on the compliance with the COVID-19 protocol. But then the issue will be whether this government has that moral right and they have that moral fortitude to tell Ghanaians to observe COVID-19 protocols when they are the number one abusers of that. They disregard all these. And unfortunately, you have some of our colleagues in who are health personnel coming to tell you that COVID-19 is not spread at funerals, rather at parties. With this mentality, I doubt if they will have the moral fortitude to tell Ghanaians to go back. But I think that's what we have to do. Yes, mistakes were made and have been made, but I think it's not too late to tell Ghanaians that, look, we have to go back to basics. Come to our place, go to the hospitals. People are dying almost every day. And I always question the number of cases they are telling you. I mean, they put out as the death rates. And because of where we are, we get to know most of these. And so when people are denying it, I go to places and, as Ohime said, when you are in mask, you are seen as the odd one. And I always tell them, yes, I know where I'm coming from, and I've seen young ones, old ones die, and that is a big loss. So I think we should go back to basics. Thank you.
Right. So we've all agreed on the fact that people are not adhering to the protocols. That's number one. But what else could be accounting for the increase in numbers the surge in cases, especially in the Greater Accra and the Ashanti regions? Do you know?
Yes. I don't know whether, when I got your call, I spoke with my colleagues from the public health unit to see whether we have been isolating the Delta variant. Each time the virus changes, they become more virulent, more aggressive in order to survive. Yes, we want to eradicate the virus. We are getting vaccines in our shoulders, in the muscles, and all that. They also want to perpetuate their survival. So they will do anything to survive. And that means changing the way they behave. They become more aggressive. I don't have statistics to back it, But I'm tempted to believe that it might be the Delta variant that probably is causing that, because you see, it's becoming more rampant, more infectious. And we've seen it. If you look at the data, you realize that between February and March this year, we had high incidence of cases. And that's when we were suspecting a new variant. And then the caseload now begins to go down to its lowest ebb and then start increasing. So probably that could be accounting for that. And then secondly, the other contributing factors, as people reported in the interview, people think it's gone. And I mean, I've traveled around most towns in Ashanti region over the past couple of days, and you can once again count the number of people who are in mask. The funerals are going on, clubs are open. In fact, it's like there's nothing happening, you know. So those are factors contributing to this. People think it's gone. They want to see people dying from it. People, we're struggling to find burial places or finding ICU places before they will believe. They think, as the gentleman said, when I was in clinic this afternoon, somebody made the same comment. Oh, it's the disease of the white men. You only see it on TV, not in Ghana. I think these are some of the things fueling the rise.
And thankfully, we have Dr. Mwakohene on, who is part of this discussion, and he's going to help us do some comparative analysis. Dr. Mwakohene, let's do an assessment of the extent of risk that Ghana is exposed to.
Aisha, thanks for having me on the show. It's pretty eye-opening when you come to Ghana yourself, having been there for almost the month of June, and then sort of coming back to the United States, looking at where we are here in the United States and what Ghana is doing. I was just shocked when I was in the country. If there was ever a thing called COVID-19 protocols, obviously everyone is fatigued. Is globally, it's a problem that everyone has been having. And I think, to answer your question though, I don't see a brighter future in terms of how we're dealing with this pandemic in Ghana. And I say that on many different fronts. Number one, when you talk about the protocols that the other panelists have sort of alluded to, it's difficult to find people really following them. So that's the first key indicator to go by. And then you look at, if you are not following the protocol, or even if you were following the protocol, what are your incidents in terms of COVID-19? And how much are you really isolating? What variants are you specifically dealing with? Are we sequencing these viruses or these sort of genomic sequencing? Are we up to speed? Do we know which variant is dominant within our communities? I had mentioned this about a month ago, and when the whole idea came about, patients with Delta variants have been isolated at the airports. And I made the assertion that early on during the pandemic in the US, when people were coming from Europe, we knew right there and then that the virus was already here. It was only a matter of time. And that's exactly what happened. If this virus has taught one thing, I'll tell you this: it moves very rapidly, and the Delta variant is highly transmissible. And so if you see it anywhere around your environment, you know you're already in trouble. So I think it's important to drive home the point that the risk Ghana is taking, it's a big risk because we're not following the protocols, and that's the reality on the ground. You just need to get out to the markets, to outside Accra, Kumasi, and you see what goes on. And so if you put that into perspective, then you ask yourself, what are we doing from the medical perspective? Are the hospitals ready to really take up these patients and treat them? Do we have the ICU capacity? And the last point I'll make is that in the US right now, when you come, most people are not wearing masks. But the reason is that we have about 45% of our population vaccinated. You can walk into a hospital, a CVS, and get a shot. Do we have that in Ghana? I mean, I think we've been hearing the story about for at least 2 months now that government is going to get some vaccines. And the question is, when is it going to come? because in a situation where people find it difficult to wear the mask, albeit fatigue and the environment that we're in, the one option you have is to ensure that you can vaccinate as many of your population as much as possible, so that perhaps you can reduce the rate of transmission and reduce the recurrence of these infectious new variants that you may not be able to control. And in fact, nobody globally is able to control COVID. The one thing we have is getting vaccines or shots in people's arms. And that, I don't believe in my own assessment that we've done enough of in terms of making sure that the citizenship is protected by getting shots into people's arms.
Dr. Bredu, there's the important conversation about resources and the fact that Ghana is lagging behind if it comes to health facilities and ICUs to fight this. Your association, the GMA, has over the period keeps reminding and warning the public that our ICUs may be filled up and we will be overwhelmed with the situation. I mean, let's talk about the management of cases right now. Are we overwhelmed?
No, so just a couple of days ago, you heard leaders who are mining the national, the case load leaders, okay, Dr. Owu, and all of them coming out to tell you that, look, we are running out of oxygen, we are running out of ICU bed. And in a day or two, that statement was counted by the Director General of Ghana Health Service, indicating that, oh no, it's not true. Ghana has a lot of ICU beds and oxygen. I think that statement is in the public domain. You see, until we stop playing such politics, this is what we'll see. Come to the various health facilities, even without COVID, even before we got the first case of COVID, how well resourced were our facilities? We all know people complain of bare space, lack of proper treatment and all that. That is how the state of the Ghana the economy, the health services. And this COVID coming in, demanding more resources, has placed so much stress on the already stressed health system. Okay, so we don't have the resources, and I tend to believe what my colleagues who are seeing these patients on a daily basis. Well, I don't see the benefits of our colleagues who are in the treatment centers lying to Ghanaians. But if they have spaces available, I don't think they will come on air or make it public that we don't have those spaces. So I will go with what those leaders who are leading in the management are saying and not what the politicians are saying. You see, when we should stop playing politics with these, okay, and let the citizenry know the situation that already our health sector is on its knees. We don't have basic things. Come to the hospitals, come to Kumasi, come to Konfanoche Hospital, come to the emergency units. You see people sitting on benches. That is the situation for you. So if you have 30, 40, 50 cases of COVID coming in, do you think such a facility, which is the biggest in the region, can support such a facility? No. My co-panelist, Dr. Amwakohene, talks about, and I think some of the people you interviewed were like, oh, you saw people on TV at the stadium and all that. Look at how many of us in Ghana has been vaccinated. From the Ghana Health Service site, they write 1,270 something, 1.27 something million. But even that one is made up of 860 something thousand that has had 2 shots, and then the 400 and something thousand at least have had 1 shot. You see, if you don't vaccinate, is it about 40, 50 or 70% of your population, you can't achieve herd immunity. The Western countries, they have done it and still they are struggling. If you take, even granted that we've had 1.2 million of our population, and we estimate our population to be about 30 million, I don't think that is even 20% of our population. okay, being vaccinated. So what we should be talking about now is about compliance. That is our only saving grace. Okay, look at the COVID vaccine politics. We are not getting the vaccines. They tell you we will be getting it in 2 months, in 6 months. As Dr. Mwakohene said, I was in the States. I am not an American, but you can walk to, they have walk-in facilities, and it doesn't matter whether you are an American, whether you pay taxes to the United States government, okay, you can walk in and have the vaccine done, because they think if you are not giving the vaccine, the chances of you getting it, okay, they see you as a human being and not as a foreigner or as an American. So they have it, and they are even pleading with their citizens to go for it. A state like Ohio, okay, had to resort to raffles, begging people to go, and you stand a chance of winning $1 million if you are vaccinated. In Africa and in Ghana, we are struggling to even get 1 million doses of the vaccines. Forget about the cost people are putting on that, people trying to cash in and all that, but we are even struggling. So we should be emphasizing on compliance. But what do we see? The politicians are making our work difficult. You or him, Teria mentioned the funerals that are going on. And I don't know, it seems it's only in Ashanti region where we have the big funerals. I mean, the politicians, relatives passing, and we have the big funerals. So you can count the number of big funerals we have had. And that is giving that idea that is gone. Health workers, I mean, those leading the fight, coming to tell the populace that these are our challenges. And you have a doctor who is responsible for the Ghana Health Service behaving like he's a politician. And honestly, I don't know whether he's a politician or he's a health expert. But it's high time we let people know that, look, COVID-19 is real. We don't have the vaccines yet, okay? And the only way to protect ourselves is to insist on the COVID-19 safety protocols.
Doc, I'm happy you talk about the behavior of politicians, and also it raises the question of law enforcement, whether there are others who are above the law, and whether even the laws that we've passed in recent times to deal with COVID, whether we're really making use of it or whether it's helping to address the situation. But Dr. Mwakohene, in the immediate short, medium to long term, what should the country be doing right now?
I think right now it's clear that any country that is not doing well with the vaccinations, it's behind. I mean, I think that's part of the reason why people are fatigued about all the protocols, albeit we're not pushing that, we're not really educating our folks the significance of following these protocols. I shall tell you this, you have countries whose GDP don't come anywhere near Ghana and are making very significant investments in ensuring that citizenship or citizens of the country are vaccinated. And we're sitting in Ghana, a very pretty rich country relative to other countries. And we've been told many times stories after vaccines coming in, albeit heavily subsidized. I think you have to begin to think about the fact that you can never place money on any human life. And you don't wait to shut your economy down, because the ramifications of having to shut your economy down, feeding people on the street, you can't even quantify that monetary wise. So it's important that you make the investment necessary to purchase vaccines to vaccinate your people. COVID is here. COVID is real. I've dealt with it. I've had it myself. It's important to know that until you are able to vaccinate your people, there's no way you're going to be able to get around it. And government, I do believe, in my honest opinion, have to really set up in terms of ensuring that we get vaccines and vaccinate our people. It's really appalling for a country, a blessed country like Ghana, that we have less than 1% of our population vaccinated. And yet the stories never stops coming. It's just, oh, we're going to get vaccines today, tomorrow, a month, 2. That cannot be right. Something is wrong. And the right people have to be put in place to ensure that we don't keep beating the same drum. and that we actually put solutions on the table so that the ordinary Ghanaian, not you, not me, but the ordinary poor Ghanaian can have some kind of safety net.
So the surest way is vaccine, vaccine, and vaccine. I'm grateful, gentlemen, for this thought-provoking conversation. Dr. Parkway Sibeidu is Ashanti Regional Chair for the Ghana Medical Association. Dr. Samuel Kojo-Amoakohene, he's an anesthesiologist, a COVID-19 ICU team leader at ACHN Health Network Connecticut, and co-founder and president of the Global Partnership Haladin LLC. Thank you so much for joining us. Ohementeria, if you're still on, tell me, do you have any updates of this crunch meeting by health officials in the Ashanti region?
Yes, Aisha, it is not only for the health officials in the region, but I must say the Director General of Ghana Health Services, Dr. Abuaje, is leading a team of the officials to look at how best they can draw up a strategy to bring down the COVID-19 cases in the country and also on bird flu as well. Currently, the meeting is ongoing, but when we try to peep in to get some information, we're told because it's a closed-door meeting, they will not allow media to also get in, but probably we can have the opportunity to speak to the authorities tomorrow. So I must say, yes, the meeting is still ongoing and it's happening at the hotel at Mesa in the Ejuso municipality, Aisha.
Ohementeria is a member of our health desk. He's our man there. He's monitoring events for us. We promise to bring you updates in our subsequent bulletin.